Welcome to The Explainer. Today, we're tackling a topic that affects millions of young children, diarrhea. Now, most of the time, it's caused by a common infection, but the real danger isn't the illness itself, it's the rapid dehydration that it can cause. So using guidelines straight from the World Health Organization, we're going to build a clear, life-saving plan for any caregiver.
So let's get right to it. What is the real danger here? I mean, diarrhea is common, right? Especially with little kids. But the true threat, the thing we really have to worry about, isn't the infection. It's what the infection does. It causes the body to lose water and essential salts fast. And that leads to dehydration, which can become life-threatening very, very quickly.
So here's our game plan for this explainer. We'll walk through why this is such a serious threat. Then, we'll learn how to spot dehydration using a super simple assessment. After that, we'll get into the WHO's 3 clear treatment plans. We'll cover home care, how to know when things are getting serious, and we'll finish up with the most powerful tool you have.
Okay, let's start with the most crucial point. When a child has diarrhea, think of their body as a battery that's being drained. It's losing fluid and electrolytes way faster than they can be replaced. This imbalance is dehydration, and it is the #1 reason diarrhea can become so dangerous. So our entire focus has to be on preventing and treating dehydration.
All right, let's dive in. How can you tell if a child is dehydrated? Well, the great news is you don't need any fancy medical gear. The WHO has laid out a simple, systematic way for anyone, and I mean anyone, to check on the situation. It basically turns you into a frontline health detective.
It all comes down to these 4 simple actions. You're going to ask some key questions. You're going to look closely at the child, their behavior, their eyes. You're going to offer them a drink to see how they take it. And finally, you'll do a gentle pinch of the skin on their tummy to check how elastic it is.
Now this is the golden rule for figuring things out. You're looking for a pattern. If you spot 2 or more signs that fall into one of the categories we're about to see, that's how you classify the level of dehydration. It's about combining the clues, not just relying on one thing.
And this chart just lays it out so clearly. You've got 3 lanes. On the left, a child with no dehydration is alert and doing fine. In the middle, with some dehydration, they might get restless or irritable. You might notice their eyes look a bit sunken, and they'll probably be thirsty and drink eagerly. But that column on the right, severe dehydration, that's the danger zone. The child is lethargic, hard to wake up. They can't really drink. And that skin pinch, it goes back very slowly. If you see 2 or more signs in any one of these columns, you know what you're dealing with.
So now that we know how to assess and classify the problem, we can move on to the solution. And this is why these guidelines are so powerful. They directly connect each level of dehydration to a specific, clear plan of action.
So for our 3 levels of dehydration, there are, you guessed it, 3 treatment plans. They keep it simple. Plan A, Plan B, and Plan C.
Plan A is your plan for home care, to prevent dehydration from starting. Plan B is for treating some dehydration, and that usually happens with something called oral rehydration solution, or ORS, at a health clinic. And Plan C is the emergency plan. That's for severe dehydration, and it means getting to a hospital for IV fluids right away.
Now, the huge majority of diarrhea cases can be managed right at home, especially if you get on it early. And that's why we're going to focus in on Plan A. The WHO breaks it down into 4 simple, totally life-saving rules for home treatment.
Just think of these 4 rules as your essential home toolkit. Number 1, give more fluid than usual to make up for what's being lost. 2, give a zinc supplement to help shorten the illness. 3, keep feeding the child to give them strength. And 4, and this is critical, know the danger signs so you know when it's time to get professional help.
Okay, rule number 1 is the absolute top priority. You have to replace the fluids that child is losing. That means giving as much as they will take. Keep breastfeeding, offer soup, rice water, but the gold standard is something called an oral rehydration solution, or ORS. It's a special mix of water, salts, and sugar that helps the body absorb fluid way more effectively than just water.
And the guidelines get really specific, which is so helpful. It's not just give more fluid, it actually tells you how much. For a child under 2, you want to aim for about 50 to 100 milliliters after each loose stool. For kids 2 and up, it's more like 100 to 200 milliliters. And the key is to give small, frequent sips from a cup. Rule number 2 is a huge one. Give a zinc supplement. Research has shown that zinc is a real game changer. It doesn't just help with hydration, it actually reduces how long the diarrhea lasts and how bad it is. It can even help prevent more episodes in the near future.
And again, the dosage is very straightforward. For infants under 6 months old, it's half a tablet each day. For any child 6 months or older, it's a full tablet. And you do this every day for 14 days. You can just dissolve it in a little bit of breast milk or clean water. Okay, Rule 4 is all about safety. It's about knowing the limits of home care. If the child becomes really drowsy or hard to wake up, if they have a seizure, if they just can't keep anything down, or if they're just not getting better, you need to get medical help immediately. These are the red flags that tell you Plan A is no longer enough.
Before we wrap this up, it's important to know that while most diarrhea is what they call acute and watery, there are a couple of other types that need a slightly different approach.
So, if a case of diarrhea drags on for 2 weeks or more, it gets a new name: persistent diarrhea. The basics are the same, you still need to focus on fluids and nutrition, but it's a sign that you definitely need to see a doctor to figure out what's going on.
And the second major one is called dysentery. The key sign here is impossible to miss. It's blood in the stool. If you see that, it signals a more serious kind of bacterial infection, and it almost always requires antibiotics from a health worker, on top of managing their fluids.
So, we've gone through how to assess a child, the 3 treatment plans, the 4 rules of home care. We've covered a lot. After all that, what is the single most powerful tool a caregiver really has?
Well, it really comes down to this. The most powerful tool isn't some complex drug. It's a simple, cheap little packet of oral rehydration salts. That perfect mix of salt and sugar works with the body to pull in water and reverse dehydration. The true power is in that simple packet, combined with the knowledge of exactly when and how to use it.
You know, the power of these guidelines isn't just in knowing them, but in sharing them. Every caregiver who can spot the signs of dehydration and knows these 4 rules of home care becomes a protector for the children in their family and in their community. So the real question is, how can you pass this on?